Sickness is a very common complaint in early pregnancy. Typically, it does resolve once you get past the first trimester. It usually doesn't start till you're about 5 to 6 weeks pregnant. So it can be about 5 to 7 weeks of feeling pretty sick most of the time. It's very uncomfortable. There's things that we can do to help with it, but it doesn't necessarily take it away completely. The hormones of pregnancy are circulating through your body, and they're just not something that your body's used to, so it tends to make you a little bit nauseous. The other thing that typically happens that helps with that leads to the nausea is your digestion slows down quite a bit. So a lot of people feel really bloated. They feel like they have a lot of gas pain, and then they feel really nauseous. And that's another hormonal response, because in early pregnancy, your body needs to absorb every single nutrient that you're taking in. And because it needs to absorb all of those nutrients, it slows down your digestion so it can do that more effectively. Some of the things that we can do to help with the nausea would be simple remedies like lemon and ginger tea. Sometimes chewing on peppermint leaves helps a little bit. Small amounts of Coca-Cola, and when I say small amounts, I mean very small amounts, because in general soda is a terrible thing, but the small amounts of Coca-Cola actually can help to settle your stomach. Also, chewing fresh ginger can do it, but that can be really bitter and very strong. So some people cut it up and they boil it and they steep it, and then they drink it like a tea, which can help to settle your stomach as well. A few other things that most people don't really realize help with nausea are sour things like lemon head candies, Granny Smith apples, and sometimes even potato chips help. I'm not saying you should eat a lot of potato chips because that's not a healthy food, but sometimes that can help to settle your stomach. Other remedies include having some crackers or something by your bedside that you would eat before you even step out of bed. They do have some newer medications that can help. There is a newer medication that is FDA approved to treat nausea and vomiting in pregnancy that your doctor could talk to you about as well. And in severe cases, sometimes patients need to be admitted to the hospital for IV fluids and other nausea medications. There are a few other nausea medications that we do prescribe in pregnancy for people that don't respond to the herbal methods or the more natural methods, or even for breakthrough from the other medication that is FDA approved to help treat nausea and vomiting in pregnancy. Sometimes, no matter what we do, it doesn't take it all away, but we can make you a little bit more comfortable with it. It's just something, unfortunately, that goes along with pregnancy, and it's just one of the things that we have to get through. It's usually short term.